Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Oldson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. If you're of a certain age, as I am, you may be interested in doing some things to reduce your risk of cancer. Maybe you avoid excessive sun exposure to lower your risk of skin cancer. Perhaps you increased your fiber intake or had a screening colonoscopy to lower your risk of developing colorectal cancer. And you may have had a mammogram or gotten an HPV shot or decided to quit drinking alcohol, all to lower your risk of cancer, or at least to detect it early and increase the likelihood of a cure. Most people don't realize that excess weight is associated with 13 different types of cancer, including postmenopausal breast cancer, uterine cancer, and esophageal cancer. It's also linked to increased rates of pancreatic, colorectal, ovarian, liver, stomach, kidney, and other cancers. I wouldn't bring up the link between weight and cancer if I thought the science was all doom and gloom. Actually, it's the opposite. There's a lot of exciting research telling us that there are things we can do to lower the risk of weight-related cancers, including things that you can do today. I hope you'll leave today's episode feeling empowered to lower your risk of cancer. And if you've already experienced a diagnosis, I hope you'll leave feeling that you have the agency to improve your health outcomes based on the research I'm going to share. Before we dive in, a quick word about how to use this information. We live in a world that's already pretty judgmental about weight and cancer. I don't want to add to that. The information I'm sharing today is meant to empower you, not to shame you or anyone else. Cancer is complex and no one deserves it. So let's focus on what we can control and what might help. That's why today we're going to talk about the science behind whether or not weight loss lowers cancer risk. We'll talk about a few recent studies looking at whether or not GLP-1 receptor agonist use changes the risk of cancer, and we'll look at whether we should exercise after a cancer diagnosis. Lots to discuss. We know that about 1 in 8 cancers can be attributed to excess weight. According to a document released by the Obesity Society in 2025, for people with a body mass index in the 40s or higher, the risk of cancer is 52% higher in men and 62% higher in women, compared to those with a BMI in the normal range. Uterine, also called endometrial cancer, is the type of cancer most highly linked to weight, with more than half of uterine cancers found in women who are heavy. Keep in mind, there's often more than one reason why people develop cancer. Genetic predispositions, environmental exposures, including toxins like tobacco, asbestos, alcohol, and even exposure to radiation. Certain medications increase the risk of cancer, as do certain diseases. We can't blame cancer exclusively on weight, but since we have ways to treat excess weight, it's one risk factor for cancer that we can modify. And here's the really exciting news. Intentional weight loss appears to reduce cancer risk. And I want to emphasize the word intentional because that matters. When researchers look at weight loss, they have to separate intentional weight loss, the kind that comes from making lifestyle changes or medical weight loss treatment, from unintentional weight loss, which can actually be a warning sign of cancer that's already present. Studies looking at intentional weight loss consistently show benefit. When people lose weight on purpose through improved diet, healthy habits, and increased physical activity, their cancer risk goes down. The effect is strongest for obesity-related cancers and particularly pronounced in women. Now, here's where it gets interesting. How much weight loss do you need to see a benefit? The data suggests that substantial weight loss, we're talking about 20 to 24% of your total body weight, is where we see the most meaningful cancer risk reduction. That's a significant amount of weight. If you weigh 200 pounds, that would be a 40 to 48 pound weight loss. Although no one is very interested in doing it these days, bariatric surgery is the most effective tool we have to achieve and maintain that degree of weight loss. And the cancer data for bariatric surgery is impressive. We see about a 30 to 38% reduction in overall cancer incidence, and even more striking, about a 50% reduction in cancer-related deaths. The effects are particularly strong for certain cancers. Endometrial cancer risk drops by 62%, liver cancer by 65%, breast cancer by 44%, and colorectal cancer by 37%. The benefits show up about 6 years after bariatric surgery, which makes sense when you think about how slowly most cancers develop. The research tells us it's really about the weight loss itself, not the specific surgical procedure, which raises the question about other ways that people lose weight. For example, what about losing weight through diet and exercise alone? This is where the picture gets a bit more complicated. There was a large study called the Look Ahead study that followed people trying to lose weight through lifestyle changes. They achieved modest weight loss, almost 9% at 1 year, settling down to about 6% a decade or so later. Unfortunately, that level of weight loss didn't show a statistically significant reduction in obesity-related cancers. This doesn't mean lifestyle changes don't matter. They absolutely do. Even modest weight loss improves important biomarkers like insulin sensitivity. But it suggests that the amount of weight most people can lose and keep off through lifestyle changes alone may not quite reach the threshold needed for substantial cancer risk reduction. This is where the newer weight loss medications come in. Lowering the risk of weight-related cancers means losing weight and keeping it off. We can help people do that with surgery, and we can also help people do that with medication. It's important to understand that medication is not a cure for excess weight. It's used to manage excess weight. If you don't continue to take the medication, the weight will almost always return. We need to think about excess weight the way we think about high cholesterol. When your cholesterol comes down on the medication, that means the medication is working and you should continue to take it, right? Same thing for the GLP-1 weight loss meds. They only help with maintenance of weight loss when you continue to take them during maintenance. So what do we know about the GLP-1 medications and cancer risk? In December 2025, there was a large analysis looking at around 94,000 people to see if they had a change in their cancer risk after taking GLP-1s. The good news is that they didn't have more cancers. That was great to see. Particularly, we're glad to see that there wasn't an increase in thyroid or pancreatic cancers, two that we were watching closely. But what that study didn't show was the decrease in cancers from the GLP-1s that we hoped for. My hypothesis is we didn't see a decreased cancer risk because the longest people were studied in this paper was about 70 weeks, not even a year and a half. Many cancers are slow growing. They can take years or even decades to develop. I wouldn't necessarily expect to see cancer rates decline in the first year or year and a half that people are being treated with a weight loss medication. We don't know, but maybe it will take 5 or even 10 years at a lower weight to see a meaningful reduction in cancer outcomes. There are some other studies, real-world data, looking at people using GLP-1s that show more promising results. About a 13 to 17% reduction in obesity-related cancer risk. So the science is still emerging here. We don't have a final verdict yet, but I'm cautiously optimistic that as we get longer-term data, we'll see clear benefits. Let's take a quick break to hear a word from our sponsor, and then we'll dive into what else we can do to lower our cancer risk. Just kidding. It's still me, Dr. Lisa Oldson, physician and founder of Smart Weight Loss Coaching. I just wanted to briefly say thank you so much to our regular listeners who follow the show and tune in every week. My team and I are incredibly grateful that you take the time to listen in and to share our show with those you care about. Many of you have asked when we're going to have an online men's program. Well, it's time. Head over to our website at smartweightlosscoaching.com, and I hope you'll be able to sign up and get started today. At the time I'm recording this, we're about a week away from going live. So hopefully by the time you hear this episode, we're already in full swing, helping women and men lose weight and live healthier longer. And we're back. Let's talk about cancer and exercise, because this is where the news gets really exciting. If you're a longtime listener, you know that the data tells us that exercise doesn't help much with weight loss. It's important for keeping weight off after you lose weight, and it prevents weight gain in the first place, but it truly isn't a great weight loss tool. However, exercise has its own independent effect on cancer risk, and the data here is strong. Physical activity reduces the risk of multiple different types of cancer. We're talking about meaningful reductions, around a 20% lower risk for colon, esophageal, and endometrial cancer, 12 to 21% for breast cancer, depending on the study, and the list goes on. If there was a pill that would reduce your risk of colon or breast cancer by as much as 20%, I think we'd all be pretty interested. How amazing is it that instead of a pill, we can achieve this with exercise? And if you'd like to, you can get this intervention for free. No gym membership required. And unlike a pill, exercise has an extremely low risk of side effects. An enormous study looking at nearly 1.5 million people found that high levels of physical activity were associated with reduced risks across 13 different cancer types. And here's what I love about the exercise data. You don't have to run marathons to see the benefit. Meeting the minimum physical activity guidelines, which is 150 minutes of moderate activity or 75 minutes of vigorous activity in total per week, provides substantial protection. There's even research showing that brief bursts of activity during your day, what researchers call VILPA, a term I just learned, and I really had to double check that that's how it was pronounced. VILPA, V-I-L-P-A, or vigorous intermittent lifestyle physical activity, VILPA can reduce cancer risk. We're talking about as little as 1 to 2 minute bursts of vigorous movement, 3 or 4 times per day total. Things like fast walking, chasing a child while playing tag, carrying heavy groceries, or running up the stairs. This kind of mini exercise burst, VILPA, is accessible to almost everyone. I feel like I'm going to be weaving VILPA into a lot of upcoming episodes because that term is just cracking me up. All right, here's where exercise becomes even more powerful. Its impact on people who have already been diagnosed with cancer. There was a landmark study called the Challenge Trial that looked at people who'd been treated for colon cancer. They were assigned to either a 3-year structured exercise program or a health education program. The exercise group had supervised sessions that included both aerobic exercise and resistance or weight training exercise. The results were stunning. The exercise group had a 28% reduction in cancer recurrence or death. Their 5-year disease-free survival was just over 80% compared to 74% in the control group. That's an absolute difference of more than 6 percentage points. This wasn't about preventing new cancers. The exercise was actually treating micrometastases, which are tiny undetectable cancer cells that might still be hiding in the body after treatment. No wonder oncologists not only allow people to exercise when they've been diagnosed with cancer, they may encourage it. Of course, please use your common sense here. I'm not your doctor, nor am I an oncologist. So if you have cancer, you should definitely talk to your oncologist to see if it's appropriate for you to exercise right now. Maybe it is, or maybe it will be soon. I just want you to consider whether it may be possible and get input from the experts who know you the best. For breast cancer survivors, and there are a lot of you out there, the data shows that physical activity after diagnosis is associated with a 24 to 48% reduced risk of recurrence. To me, these numbers are incredible. In fact, for various cancer types, we're seeing up to a 40 to 50% reduction in cancer-specific mortality, meaning death, with regular physical activity after diagnosis. Think about that for a moment. Exercise is performing as well as many cancer medications, but with the beneficial side effects instead of the harmful ones. Of course, I'm absolutely not advocating that you use exercise instead of appropriate medication, just in conjunction with it, with the approval of your oncologist. You know what else the research shows? Post-diagnosis physical activity, meaning starting exercise after you get the diagnosis, provides greater mortality benefits than pre-diagnosis activity. So even if you weren't exercising before your cancer diagnosis, starting afterwards still makes a tremendous difference. The optimal combination seems to be more than 300 minutes per week of moderate intensity activity combined with strength training at least twice a week. 300 minutes a week means an hour, 5 days per week. But again, even lower amounts may provide some benefit. And you don't have to start there. Just start. That's what's important. Start after you talk with your oncologist, of course. I can't say that enough times. One study showed that among breast cancer survivors, just 1 hour per week of activity is associated with a 25% reduction in all-cause mortality. That means there's a 25% lower risk of death from any cause, not just cancer, with 1 hour per week of exercise. So let's bring this all together. What can you actually do with all this information? I've got 5 interventions that you can make to lower your cancer risk related to weight and exercise. First of all, if you're carrying excess weight, work toward intentional weight loss. Whether that's through lifestyle changes, medication, bariatric surgery, a program, or some combination, depends on your individual situation and how much weight you need to lose. Talk with your doctor about what approach makes sense for you. The goal isn't fitting into a size 2, nor is it necessarily getting your BMI into the normal range. The goal is to make some progress in the right direction. Second, if you're using medication for weight loss, plan to stay on it for the long term, with your doctor's support. We're treating a chronic condition just like we treat high cholesterol or high blood pressure. The medicine works when you take it, so think of it as a tool for maintaining your weight loss, not just achieving it. Third, make physical activity a non-negotiable part of your life. Aim for at least 150 minutes of moderate activity per week, but know that even small amounts help. Fourth, add strength training to your routine. Resistance training has its own independent benefits for reducing cancer risk and improving outcomes after a cancer diagnosis. You don't need a gym membership. Bodyweight exercises, resistance bands, or even carrying groceries can help build and maintain muscle. And fifth, if you've been diagnosed with cancer, don't stop exercising. Talk with your oncologist about what's safe for you, but know that the evidence strongly supports staying active during and after cancer treatment. With exercise, you've got a powerful tool for fighting cancer and improving your survival. The bottom line is this: you have more control over your cancer risk than you might think. Excess weight increases risk, but intentional weight loss decreases it. Exercise protects against cancer and improves outcomes after diagnosis. And the beautiful thing is, you can start making these changes today. You don't have to wait until you've lost all the weight you want to lose. You don't have to wait until you can run a 5K. Every positive choice you make, Every walk you take, every pound you lose, every strength training session you complete is reducing your cancer risk and improving your health. Now, it's time for your NBA, your next best action. Choose one thing from today's episode that resonates with you. Maybe it's committing to a brief walk today or tomorrow. Maybe it's scheduling an appointment with your doctor to talk about weight loss options. Maybe it's trying a free online strength training session right after you listen to this podcast. Whatever it is, write it down, make it specific, and then do it because you have the power to make choices today that will impact your health for years to come. You've got this. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.